what is capsular contracture? One thing to remember is anytime you have a foreign material in your body's response to it is to wall it off or form a capsule around it. So that means even if you have a pacemaker, for example, you'll form a capsule of tissue around it. If you have a portacath for chemo, you'll form a capsule around it. The same thing is true for breast implants. You'll form a capsule around that breast implant because your body is walling off that breast implant. A normal capsule is literally a cell layer thick. It's very thin and it's soft and it's benign. But sometimes people can develop what's known as capsular contracture. So how do you know when a capsule is normal versus abnormal? So as I mentioned, a normal capsule is very thin and soft. So that would be grade 1. Capsular contracture is graded on a scale of 1 to 4. Grade 2 is when you can feel the breast implant a little bit. Grade 3 is when you can actually see the distortion that capsule, as it has thickened, has formed around that implant. In other words, sometimes you'll see or you'll notice that a breast is high and tight and hard. Grade 4 is now that same capsule is very painful. So not only is it disfiguring and looking abnormal, but it's also painful. Typically, when we talk about capsular contracture and needing surgery to help alleviate or correct it, we're talking about grade 3 or grade 4 capsules. Grade 1 and 2 capsules are within normal and you don't really need to worry about it. The other question people may have is, why do we get capsular contracture? There are numerous theories as to why it occurs. Some people have hypothesized that it's due to a low-grade infection. Others say it's just a reaction of your body to that implant as it's gotten older. But it's really hard to know. Most commonly, if you're going to get capsular contracture, you get it within the first 1 to 2 years of having your breast implant. And so usually we know right away. The other thing to remember is if we do have to do surgery to correct capsular contracture, once you've had capsular contracture once, your risk of having it again increases. So it's something we have to be very careful about. There are some things that we do as physicians that we know will help minimize the risk of capsular contracture, and those things include vitamin E, which sometimes I'll have my patients take orally for the first few months after their breast surgery because vitamin E helps to keep the capsule soft. Another option that sometimes we may try is something known as taking Singulair, which is an anti-asthma medicine, which can also help to keep the capsule soft in certain cases.